meeting pursuant to Governor Baker's March 12th, 2020 order, suspending certain provisions of the open meeting law. We are able to participate this way via remote participation. I'm sorry. The meeting is being live streamed by the Westwood Media Center. Thank you very much, Connor. I don't know what we'd do without you, particularly over the last 3 or 4 months. Public can view this meeting by accessing the link is listed in the public notice, by going to the Westwood Media Center, or by watching on Comcast Channel 12 and Verizon Channel 42. Every effort is going to be made to make sure that the public can participate in this proceeding. And if we're unable to do so, this proceeding will be available by audio and video recording. Westwood Media Center is recording this meeting with our permission. Is there anyone else present that seeks to record this meeting? I hear no response. Have you gotten any response, Connor?
No, the only people who are in here right now are the committee members.
Okay, and Nora, I see Nora Loughnane is on. Okay. Let's see. Let's go back to the minutes. Back to the agenda. Did everybody have a chance to review the minutes?
Yes.
I had one change. At top of page 3, I think we meant to put in the word swab instead of swap. So we're not doing a nasal swap. We're doing nasal swab. Is that right?
You got it, Jim. I'll change it. Thank you.
Okay. Some of us may want to swap, but
Yeah, that would be tough to pull up.
And then I noticed on page 2, the first paragraph, town council is attempting to get injunctive relief from Superior Court to have the quorum reduced to about 140. I think it was 40 or 44.
44.
Okay.
Yeah.
All right. Got it. Thank you.
And he did a great job on that. He's a good lawyer, Carol.
Yeah.
I was like behind the scenes. I know. Well, everybody pulled through, right, Jim?
Yeah, but I appreciate good legal work. He was a very well drafted complaint. I think we got better relief because of the way he drafted it than we would have had we relied on the statute. And I'm getting the sense we're going to have a good crowd tomorrow night. So
Good. I think people are looking forward to getting out.
I think so.
If the weather's like this, we should do all right.
I know Lincoln had a big crowd on Saturday. I don't know how many Hull had last evening, but they had an incident where some 70-year-old gentleman attacked the town administrator.
I heard that. I don't even know what it was about, but I heard that on the news. Yeah.
I suspect there was some history there, so
Yeah.
we'll keep an eye out
Okay.
for Chris. All right. Let's see. So with those changes, is there a motion to accept the minutes as amended?
I move.
Second,
I second
Carol?
it.
Okay. Carol, how do you vote?
I vote yes.
In favor of the minutes? Roger?
Yes.
I vote in favor of the minutes as well.
And I do as well. So the minutes are approved unanimously as amended. Now, I'm jumping around from document to document. Next, we have the appointment of Henry D'Angelo as the Board of Health physician. You want to take that, Jared?
Okay, so we're asking the board to vote in favor of the appointment of Dr. Henry D'Angelo as the Board of Health physician.
And that's a reappointment. He's been appointed for a number of years.
Correct.
Any discussion?
No.
Okay. Carol, do you vote aye? In
Yes,
favor?
I vote yes. Aye.
Yeah. And Roger?
I vote aye as well.
And I vote aye as well. Okay, he is appointed. Let's go back. The reorganization of the Board of Health for fiscal year 21. I think I'm up for reappointment. I don't know if the select board wants to reappoint me. But assuming I am, should we pass the chair to someone else?
I don't see why we should, Jim.
Well, I just feel like somebody else should do it. Someone else should get the notoriety, I guess. I'm not doing it because I need it.
You don't like the pay?
Yeah, that's right. You haven't been the chair yet, Roger. How about you
No.
taking on for a year?
Okay, I'll try it.
Okay. I nominate Roger to be the chair. All in
I
favor?
second it.
Okay. Carol, vote aye.
Aye.
Roger?
Can I vote for myself?
Yes, you can.
All right.
And I vote for you as well.
All right. Congratulations, Roger.
Yeah.
Thank you.
Can we play Hail to the Chief? Or
Not technically, not unless Connor can whip something up. I'm not sure we can do it.
okay.
That's outside my power.
Now, Jared, next week on the agenda we have your support at annual town meeting.
Right. So I just wanted to kind of review where we are in terms of the Board of Health and town meeting, and see if you had any additional questions or comments or concerns in lieu of sort of the Q&A and of the best practices we presented. So I will be on site tomorrow at the town meeting to supervise the social distancing and the appropriate COVID-19 safety precautions that we've asked the residents to implement to reduce the incidence of COVID-19 spread by bringing a group together. So I don't know if you have specific questions. We're going to have signage, there are robocalls, and like I said, I'll be present to add support or instruction or education to any residents or staff on site who might need it.
Your notice was great. I appreciate all the help you gave me. I know it's been a lot of work for all of you, particularly some of the other things we're going to discuss. One of the, I guess, sort of related is, do you have enough staff with all of this going on? Do you have enough help? Not only town meeting, but supervising phase 1, phase 2, reopening of the restaurants.
I mean, it's a work in progress. I think right now, from the beginning, I'll give all the credit to our department, to Tiffany and Lorraine and Jason for all that they've done, sort of above and beyond what is normally expected, to make sure that we're as on top of this pandemic and the response to it as we can be. As we transition to these phases and the reintroduction of licensed and regulated entities, they will require additional oversight because not only do we have the traditional inspection routine that we have to go through, now we have the additional layer of COVID-19 safety. So we have agreed with former director Linda Shea to assist us in summer camp review for standard operational procedures and COVID-19 safety to help guide us into the summer. That'll free up Jason to focus in on the restaurants and the seating issues that are going to arise. And Tiffany and I will focus in on the field inspections for the camps as well as the swimming pools. And then EEE, which is going to be probably something we'll be dealing with more seriously as we move into the summer. So as of right now, with the addition of Linda part-time as a consultant, I'm confident we can, get done what we need to get done. Should circumstances on the ground change, we may seek out some additional resources if we need to.
That's a good idea. I hadn't even thought of Linda. I suppose you could always call Cheryl too if you need.
Yeah, we have Cheryl. We've been speaking with her on assisting with restaurants in some capacity. I still don't know, what's going to be kind of all-encompassing requirements for them once they actually get the indoor seating portion of their reopening plan approved. Once that comes and we have a date firm on that, then I think we'll probably reach out again.
Okay. Anybody else have any questions?
Oh, I'm wondering about the town meeting. Will there be masks available there for people?
There will be a supply of masks available for people who show up without, who wish to have one. And there will also be a separate seating area for people who aren't going to wear a mask. We're going to ask them to sit in that area. So we will have some on hand for anyone who needs one.
Good, thank you. Then a statement. I'm happy to help with any of the activities that have to go on.
Thank you. We're still waiting for regulations to roll out, so things are, things are coming out slowly. I mean, last week we did get a pretty good amount. The camp reg and the revision to the camp reg, the swimming pool, guidance has come. So now we're reaching out to individual operators to discuss their situations and how they plan to resume operations, if they plan to resume at all. Trying to get a tally, especially for the camps, the summer camps, trying to see how many of them, particularly the partner camps up at Hale, they have much more logistical challenges to deal with because they all, they all originate outside of town and they bus the students in or the campers in. So that's going to create some hurdles for them to see if they're going to wish to continue in some capacity for the summer, or trying to reimagine what their camp is and maybe keep it closer to home. So that we're still waiting to find out.
Are there strict limits on how many kids can get on a bus, Jared?
There are the limits of as many children that can keep the 6 feet of social distancing. There is some relief if those buses have like plexiglass barriers. I believe the capacity would increase. So I imagine a regular bus seats about 50 people-ish, 50, 60 people. So I would imagine a full-size bus probably can only accommodate about 15 kids, or plus the bus driver and the counselor. So that is something they're going to all have to determine.
And who supervises that? Is that something you do, or that's...
The transportation plan is part of the SOP. So once we get a sense of who's coming and if they're going to use buses, there'll be more discussion with the camp operator and the bus companies to make sure everybody's on board. The bus company would need a document to demonstrate that they're going to follow the appropriate sanitization practices for transportation, which would be sanitizing the seats in between runs and, that kind of stuff. So
Wow.
it's a lot.
Yeah, it sure
Wow.
is.
Yeah.
Sure is. And any sense of how many restaurants are planning on opening with outdoor seating in town?
Right now, with outdoor seating, I think there have been maybe 5 or 6 inquiries to increase, and that's going through the licensing division and the select board's approval process to give them some alternative seating. And if a restaurant already has existing outdoor seating, they're welcome to utilize it at this time, provided they space it out at the appropriate 6 feet. So like an Anthony's Coal Fire Pizza, for example, has a patio. They can utilize that patio as long as they space everything out 6 feet. So,
Jared, can a restaurant seat people at the bar if they have plexiglass dividers?
they cannot sit at the bar proper, like in an elevated linear bar, but they can sit in the bar area if the tables are 6 feet apart. If the tables cannot be spaced 6 feet apart, they could install plexiglass barriers. So the traditional bar, is not available right now, but they can use that space for additional dining room seating.
I see. Okay. Okay. Oops. Wait a minute. There were no more questions on the Board of Health support on the annual town meeting, I take it?
Correct.
Okay.
No.
And I got you off track, Jared. Sorry about that. Are you into your report already?
Yeah, we kind of covered some of it. I can fill in the gaps. So for COVID-19 cases, last week we had 0 increase in cases, so that was welcome news. So we're still monitoring, for this week, but we're holding at 122 total cases since they started keeping track. There is going to be a pop-up testing program that Mass DPH is instituting on the 17th and 18th of June. We will post on our website the locations where this free pop-up testing will be taking place. There is also going to be pop-up testing at participating CVS's, but that's by appointment. So we're going to get that information out on our website. So in response to sort of some of the mass gatherings over the last few weeks, these pop-up test sites are going to be set up in different areas to allow anybody who may have attended a gathering, a large gathering, demonstration, protest, vigil, or what have you, can go and get a test for free and without needing medical clearance. So DPH is spearheading that. I think it's a great idea, so we're going to post up the testing sites to the website. I don't believe that there's one super close to Westwood, which is unfortunate, but there are many in the area. Hopefully people, if they need to, can get to. The other major issue we're going to be, obviously, camps and pools. We have the go-ahead from the state to allow them to resume operations with additional COVID-19 safety protocols. I mentioned that before, so we're in the process of contacting each vendor or each business to see what their plan is and working with them to be in compliance, and then scheduling the inspections. We have 2 outdoor pools in Westwood that are eligible to reopen. We have the outdoor pool at Lifetime Fitness, and there's a pool at the residential building at the Gables on University Station. So those 2 are eligible to reopen and are planning to do so. They're just trying to get their ducks in a row in terms of traditional pool safety with the added COVID-19 safety. And Triple E will be the next thing that we have to, and ticks also, we have to start our educational campaign to remind everyone about preventing mosquito bites and preventing tick bites. Post some information from the mosquito control district to alert residents if they want to opt in to having their yard treated. There's a process to do that for mosquitoes, and start the monitoring of the catch basins for any mosquitoes that may have West Nile virus or Triple E. So if you all remember, this is thought to be year 2 of a 3-year cycle, which started last year with a fairly robust movement of positive Triple E mosquitoes up until I think Walpole might have been, and it didn't quite reach us here. So we would anticipate that this year we will be impacted in some way by Triple E positive mosquitoes, which would then lead to us having to work with our town partners, especially around the youth athletics and after school activities that may be operating at dusk outside heading into the fall. So never a dull moment, but we'll take it as it comes. Other than that, I think we're looking forward to moving ahead with the additional licensing of the camps and kind of getting everything back on track to resume some of our day-to-day office duties. So I'm in the office today, and I actually didn't know how much I would miss the peace and quiet. So it's nice to be here. So that's kind of where we're at in terms of right now. I didn't plan on us having a meeting in July. unless it were absolutely necessary. And I thought we would maybe make a decision on August, depending on what happens with positive COVID-19 cases and what happens with mosquitoes, because we may have to vote to impose some restrictions on activities if the conditions with mosquitoes so warrant.
You can't impose a 6-foot distance requirement on all mosquitoes?
We could try. Enforcement will be a challenge.
I did want to ask you on the testing. Is that just available, or is the DPH urging everyone to get tested?
I believe the language is get tested if you are at one of these large community events.
Okay.
And that will help us stay ahead of it if there was any community-based transmission due to the proximity. So if there was, the best thing to do is to get people tested on the front end rather than risk them being able to infect others while not fully realizing that they may be either asymptomatic or pre-symptomatic, which is kind of how these cases tend to escalate. The are not for the individual, that how many people they can infect before they realize that they need to isolate. That's really the number that we need to get down as close to zero as possible to control the spread.
Okay, I hadn't even thought of that. So if people are or have fallen within one of the risk categories, or if there's a possibility they could have been infected, we would really like them to get tested.
I believe we would like anyone who feels like they need a test to be able to get tested, and that is the goal, and I think that is one of the goals that is for future phases. Part of the actual plan is to make sure we're able to get people tested sooner, to reduce the opportunity for someone to not know that they're infected, because obviously if you don't know you're infected and you don't have symptoms, there is still risk that you could spread the virus even if you're taking all the precautions. The risk is still there. It may be lower than if you are practicing all the recommended precautions, but there's always a risk there, because it's just I think a hurdle for all of us when we feel fine to maybe let lapse some of our personal, protective measures, especially now when it's sunny and 75 degrees.
Right. All right, and then Tiffany's report that came out speaks for itself.
Yeah,
Anybody have
Tiffany had some on a previous engagement. Since we moved the time to 12, she was unable to make it today.
It's understandable. Do we have anything else?
No, I don't think so.
All right. Well, thank you, everybody. Thank you, Jared and Jason and Lorraine and Tiffany, for all you're doing. I know it's an awful lot of work. We're all kind of flying by the seat of our pants here, but you're doing a great job.
Thank you.
Thank you.
Yeah, no.
Thank you very much.
Again,
Right. See everyone. Everyone stay safe.
Thank you.
before you go, Roger.
Yes.
To give all due credit to Tiffany McCarthy for the contact tracing. It's she's not here, but she's definitely been the leader on that, and there's no doubt in my mind that she saved people from becoming infected and possibly saved lives with her efforts. So it's very very proud of the effort that she put forward.
All right. Is there any evidence that her success has been improved in terms of the number of people who will share their information?
That she is able to reach people. I think that to be as forward on the notifications and the communication as she was, I don't know if we can quantify, but reaching people at the beginning of this, before the student collaborative was put online, and before the community tracing collaborative was put online by DPH, it was really one person calling Westwood residents who were testing positive and giving them the information that they needed to stay safe, to not infect their household members, and keeping sort of a lid on the community transmission, because like I said, before these collaboratives were rolled out, it was really one person, and that person was her.
I'm sorry, that person was Tiffany, is that what you said?
Yes.
Yeah. Maybe Lorraine can make sure the minutes reflect your statement, and we thank Tiffany for all she's done.
Okay.
Will do.
All right, do we have a motion to adjourn?
I so move that we adjourn.
A second, all in favor? All right, the meeting's
Aye.
adjourned. Thank you,
All right.
everybody.
Hi, everyone.
you.
Thank you.
Thank you.
Bye-bye.
See anybody?